Hello, this is Dr. Lewerenz here at Longevity Health Institute in mid-January 2023. And I wanted to share with you a few things. That one is I brought a friend I'm going to introduce you to. Kind of comical here actually, but something I think that you'll get the point, and talk to you about something about the medical values, the medical system, about our responsibilities, and about what we should be doing right now in 2023, and how we as practitioners, physicians, providers, in where we're at now, because where we're at in January, in 2023, what we know now and what we can do to help prevent cancer, to help immunity, to stop heart disease, and prevent blood clots and cardiovascular inflammatory heart disease, because we're post-pandemic and there's a lot of things going on. Okay, so let me introduce you to my friend here. So this is Hippocrates, the first physician. Okay, so I do not play with this guy often, but he's in my office as a representative, as a model, and I want to read to you just something here on the Hippocratic Oath. Okay, and that's something that we literally take in medical school, and when we start and graduate in that. And I want to read you a couple things here, and it says, according to this oath, according to medical law, I will apply diet measures, health measures to benefit the sick accordingly to the ability of my judgment, and I will keep them from harm and injustice. I will neither give a deadly drug or anybody if asked, nor I will make a suggestion to the effect, okay, to anything that is harmful, meaning I will do no harm. Okay, so that's Hippocrates, cute little guy here. And then here's I'm a DO. I think a lot of you know, and that's a whole nother story. We're very similar, MDs and DOs, same training, a little bit different philosophies and models in medical school, same residencies, etc. Long story short. But here's the osteopathic oath. And the osteopathic oath is very, very, very similar. And I have this in my office displayed in that, but it's also about doing the right thing, about us holding our values and our system up, and caring for one, caring for others, caring for the sick and the needy, being a representative in our community, and always essentially doing the right thing. And one thing I've taught my practitioners, and I hold ourselves high in our values, in our core values, but also in just how we operate day to day, in our culture here, our office culture, is doing the right thing. So let me tell you what's going on in stuff that you probably heard of, but I want to share with you, and this is not controversial at all. There's no debate here. There's no controversy here. I want to be clear. And that's about COVID-19, about the virus itself, the Wuhan virus itself, but also about the COVID messenger RNA vaccines and what's happening here. Again, what we know now in mid-January 2023. And that is the astronomical rates of increased inflammatory heart disease in the world, poor immunity, immune suppression, autoimmunity, earlier mortality, all ages. Okay, actually, there's a UK study and a Parliament inquiry going on, or has been going on for several months right now. You can look that up right on YouTube. In fact, follow Dr. Campbell, a MD out of the UK, non-judgmental, just following the science. And they're investigating numbers about why the mortality rate in the UK is fourfold higher post-pandemic from pre-pandemic. And I don't think there's one answer, but I want to share with you some things that are going on so that you, right now in real time, you can at home, even if you don't see us, you can share this with your practitioner, with your provider. You can have, good quality discussions, okay, that shouldn't be too overbearing, and get to making sure that your immunity is good, that your blood's not too thick, that you're not at risk for any accelerated cancers, okay, and that you're not at any cardiovascular risk that may be asymptomatic. Because this is what we know in science. We know the physiology of COVID-19 and the vaccine, how it works, because they're very similar. So it's hard to tease through, the science right now and the data about who and what happened to what, because most of us, probably a good 70-80% of the population, have had COVID to some degree, whether they know it or not, okay? And there's data and science, and you've heard me talk in other videos about this, okay, but they cause big issues in tissue, in your immunity, and I'll explain that in your vascular system, in inflammation in your body, okay, organ destruction in your body. 5 organs the virus hits, okay, and damages. How long that is, we're not sure, probably 6 months or so, maybe longer, okay, this is what long haul is. But long story short, there's a few things to be mindful of. One is if you've been vaccinated, okay, regardless of when, okay, and how many times. If you've had 2 shots, I would guarantee that you need, because there's going to be value in this, there's going to be statistical value in this, is that you should have your doctor or provider, which we do here with our patients all the time, and we have been since 2020 when COVID hit, but is to have a fibrinogen test, have a D-dimer test, have some inflammatory tests like a CRP, an IL-6, an IL-10, because these are things that show potential vascular inflammation, vascular clotting. Now, if you're really suspicious, you can do other immune numbers like a CD4, CD8, a CCL3, 4, or 5, and these are reflections of your immune response. And if you're essentially immune compromised, like an HIV patient or like an immune compromised patient, or if you potentially have an overreactive immune system like autoimmunity, okay? And if you're really suspicious of cardiovascular plaquing and cardiovascular, microvascular damage and injuries and clotting and all that, you can actually draw a activity of von Willebrand factor. Because what happens with COVID and the acceleration of the vaccine, COVID-19, is that it's actually affecting your ACE2 receptor, which is in a lot of tissue, okay? But mostly it's in your endothelium, of your vasculature. So of all your vessels that course through your body, you have ACE2 expression. And what happens is that when ACE2 is injured or blocked or what have you, your blood and is compromised through COVID and the vaccine, you actually cause, if you will, okay, an increase in von Willebrand factor. Well, von Willebrand factor makes your blood thicker. Your fibrinogen goes up, potentially your platelets can go up, but you're more clottable. So then you add other risks on with some patients like diabetes, bad guts, inflammation in their body, hypertension, previous heart disease or strokes, advanced age, because we all get vascular issues with aging and endothelial function, and you have a perfect storm for a blood clot or what have you. I literally had a patient in my kitchen just next door here today at lunch that was that's not true, not a pharmaceutical rep, but a company rep, like a pharmaceutical rep, that does some cancer testing, and they brought us lunch, and we had a very insightful talk, and I didn't realize this, but for the last year, post-vaccine, post-COVID, she was destroyed, and I mean that. Sounds horrible, like I'm being too emphatic, but she had blood clots, she had a PE, she was in the hospital for 2 weeks, she had major stuff happen to her post-COVID, and then with vaccine was even worse, and long hauled for about a year, okay? And she is actually only in her 40s. So this is real. You know people out there. It's happening in other countries. In fact, in a small county in the UK, a study has been performed in a small county hospital that inflammatory heart disease, all ages, but very high in ages 18 to 38. So pericarditis, myocarditis is fourfold, over 4 times since COVID. Now, they don't believe it's just COVID, they believe it's the vaccine too, but you can see that there's a lot of injuries happening to the vascular system, to the immune system, and it's happening globally. In fact, there are some very open discussions in very open science in the UK and Australia, and big investigations going on, and there's a lot of recommendations to stop the boosters, and we'll see what happens here in the US and what the CDC says. But what we know is that we're in a whole different place now in January 2023, and you need to look at yourself, make sure you're not at risk, okay? But you also need to halt and go, wait a second, okay? The other thing is, if you've had COVID, you have innate immunity. So if you've had natural COVID to any degree, you produce T cells that have a memory immunity, okay? And now you will get cold vid, meaning a cold from COVID. You might get a sinus, you might get a little sore throat or a little respiratory, but it definitely won't hit you as hard as Omicron or as the Wuhan strain, okay? No matter what's going on, because you've had it and you have innate immunity. There's a memory immune system, and that's what, grateful we have. But let's first do no harm. And let's also, with our knowledge that we have here, like Hippocrates has taught us, like the Osteopathic Oath has taught us, let's look into some of these things to make sure that our patients are safe. And what I mean by that is drawing labs to people to make sure that their blood is not too thick, that their fibrinogen or their von Willebrand factor is not too high, that their platelets aren't too high, that they don't have a high D-dimer, or that they potentially don't have a weakened or hyperimmune response. So an immunity that's off, okay, that's imbalanced, because that's when autoimmune disease happens, and that's when we get chronic illness and can't fight. And remember this, animal studies show this and have years ago in studies. We don't develop cancer tumors like this. They become one cell that actually, with a weakened immune system, and often I see here in the practice, stress, and actually bad guts that weaken your immune system, one cell become 2, become 4, become 8, become 16. You see what I'm saying? Now you got a tumor. Why does that happen? It's because you have a weakened immunity. You have a weakened immune system. Okay? Don't let that be you. And if it's you, let's get it corrected. We have methods, we have models here that correct this and treat people very efficiently and effectively. But the first thing is you have to have the knowledge and you have to have the look in it. So if you're out there, get these tests, be mindful of it. Stop the COVID-19 vaccines. It's ridiculous at any age. Okay, if you've had already 2 shots and you're elderly or immune compromised, okay, and you're at risk, I get it, but you've had 2, you're protected there, plus you've had probably the infections, you have innate immunity, okay? And we want to stop this suppression of our own immune system. I actually have somebody, when I get off the video here, that I still have to make a phone call tonight because she has had 3 weeks of an upper respiratory infection because, again, she had COVID about a year ago, and that does weaken your immune system, and it's not uncommon that these now coughs and colds and stuff like this, okay, from the weakened immune system, that actually you have a hard time fighting some of these things. Now, nothing serious, but the point is there's an immune depression that's related to this, and we can address it and improve it. One of the things that's very interesting that came out, and the type O patients, type blood patients, actually have a lower lymphocyte count. And lymphocytes are one of our big factors that we need to mount a good, robust immune response. Okay, in fact, actually COVID-19, the virus itself, suppressed your lymphocytes, and that was part of the problem why you could not mount a good response, or why it hit us a little bit harder. Well, O-type patients are like that. What happens in people post-COVID is they have lymphopenia. Part of your white blood count gets lower, your lymphocytes get lower, and you can't mount immune response that's robust enough to fight even your little coughs and colds. So hopefully this is insightful and not shocking. I'm not here to be shocking. I'm here to give you knowledge to address with your practitioner and your provider and your doctor, etc., because these things can then be, headed off, and we can stop blood clots and earlier heart disease and cardiovascular events and immune issues and cancers and stuff that are at astronomical rates compared to pre-pandemic. And I don't think this is coincidental. Let's do the right thing, okay? This is Dr. Lewerenz. Be well.